You're on mute.
Good afternoon, everyone, and welcome back to Good Health Wins. My name is Jovan Turner, and I am a member of the Alamance-Guilford section of the National Council of Negro Women. This week, we have been spotlighting various presenters who have given us valuable information on Good Health Wins. Before we begin with tonight's segment, I would like for our president, Margie McLean, to come and greet you in her own way.
Good evening. My name is Margie McLean. Again, I'm the president of the Alamance-Guilford section of the National Council of Negro Women, and I'm also the North Carolina State Coalition First Vice President. On behalf of the Alamance-Guilford section and the North Carolina State Coalition, I would like to welcome you to our Good Health Win Week, and I believe this is day 4. And we been doing having some really great speakers this week. And tonight we have another speaker who will be speaking to us about the vaccines, the fact and myths of the vaccine. And we'll also have a workout session. So I'd like to thank you for joining us. Please share. And I also would like to thank Dr. Webb for joining us as well. Thank you.
Thank you, President McLean. Right now, what we're going to do, we're going to introduce Dr. Padonda Webb, who is the Executive Director of the Student Wellness Center at North Carolina A&T. And I'm going to let her talk a little bit more about herself throughout her presentation. Dr. Webb.
Thank you, and thanks for having me today. I appreciate this opportunity to be able to speak about COVID-19 vaccines. It's a topic that I am truly passionate about ensuring that everyone gets vaccinated. So thanks again. I am Padonda Webb, as you said. I'm the Director of Student Health at North Carolina Agricultural and Technical State University, and I have been here for almost 6 years. I am a board certified nurse practitioner and have been since 2006. So I've been around for a while. COVID-19 is something that I have studied a lot about. So if you have any questions, I may not have all of the answers, but I promise you I will have a lot of the answers that you may have today. So please feel free to drop any questions in the chat box, and I am here and available to answer any of those questions. So I prepared just a brief presentation today, just to go over some of the common myths and misconceptions about the vaccine. All right, so just a little bit of brief information here. We're going to talk a little bit about the Pfizer and Moderna vaccine. They are the messenger RNA vaccine. So basically, what it means is that the vaccine essentially sends your body a message, tells your body how to recognize COVID, how to protect you from contracting COVID-19. We have seen over 68,000 people participate in the clinical trials. So there's a lot of discussion about whether or not the vaccine is safe. It's been tried on 68,000 people, and no significant safety concerns were identified. Pfizer vaccine is about 95% effective, and Moderna 94.1%. So those are the two that I'll focus on today. Of course, Johnson & Johnson is available as well, and it sits around 74% as far as efficacy. Certainly, still a good option outside of not being vaccinated at all. So, all right, so we're gonna go through some of those myths when it comes to the vaccine. All right. So the first of them is you can get COVID-19 from the vaccine, and that is not true. Again, this is a messenger RNA. So essentially what the vaccine does, I make a comparison to a snitch a lot in presentations and discussions with the students on campus. And so I compare it to a snitch. So essentially, if you have somebody who is a snitch, nobody really likes a snitch necessarily. You don't want anybody snitching on you, but if you're the person on the receiving end, the person who the snitch is telling the message to, you can appreciate the message that they are sending you. So essentially, if the snitch tells you, hey, COVID is down the street, COVID is coming for you, he's got on some blue jeans and a white shirt, it is the snitch is telling you exactly what COVID looks like. So if COVID comes and knocks on your door and COVID has on blue jeans and a white shirt, then your body already is prepared, knows how to fight COVID. When it comes to the variants, COVID could present itself a little bit differently. We're fighting the Delta variant right now, for instance. So again, if COVID presents itself with blue jeans and a red shirt, but guess what? You had already gotten the message anyway that somebody was coming for you. So even if it presents itself differently, you're already aware that there is trouble coming and your body is prepared to respond and prepared to fight. Whereas if you did not get the vaccine or did not get the message, then you would not be prepared and potentially be one of those people that's in the ICU fighting for your life. Myth number 2, masks don't work. Masks is our first line of defense. They certainly do work. Of course, masks coupled with the vaccine certainly is going to give you more protection, but I want to encourage you, especially now, to be sure that you are masking. COVID-19 vaccine was rushed, so it can't be trusted. This is probably one of the top myths that I've heard. And just know that COVID has been studied for greater than 20 years. The lead scientist is right from Henderson, North Carolina. Dr. Kismihia Corbett has been studying this the bulk of her career. There was no need to make a vaccine for COVID because there was not a global pandemic. Now that we have a pandemic, the research had already been done. So it was not as difficult to create a vaccine because the research behind the scenes had already been done. You don't need the vaccine if you have already had the virus. And we know that that is not true, especially with different variants that are out here today. So even if you've been positive for COVID, we still encourage you to get vaccinated. As we know, the more protection you have, the better you'll do. And we are trying to keep people out of the hospital. So COVID-19 vaccine can cause cancer. We know that that's not true. There's no scientific research that supports that myth. So we can throw that myth out of the window. The vaccine contains a microchip. And we know that that's not true as well. So I want to go ahead on and dispel that myth today. The vaccine does not contain a microchip. COVID-19 vaccine can cause infertility and pregnancy. Again, there's been no scientific research that has been done to suggest that it can cause infertility or cause any bad outcomes in pregnancy or breastfeeding or any of those things. In fact, with breastfeeding, we actually encourage breastfeeding moms to get vaccinated so that they can pass on some of those antibodies to their child. So why should you get the vaccine? Overall, it's going to take all of us pulling together to get out of this pandemic. Nearly 40 million people have been diagnosed with COVID-19 in the United States. That's a lot of people. 650,000 deaths have occurred. So I'm sure every single one of us knows someone who has succumbed to COVID-19, and no one ever expects for it to be them. So again, it's one of those acts of kindness. You want to make sure that you get vaccinated, not only for just yourself, but for your family as well. You don't want to be a casualty. You don't want to take the virus home to your family. So protecting yourself from serious illness and death is certainly where we're trying to get people. And so I encourage you to do your own research. Make sure you're looking at evidence-based websites. Check out the CDC's website. North Carolina Department of Health and Human Services has a lot of great information out there. And just be careful about some of the things that you may see floating through Facebook and your messenger, because some of those things just aren't true and they're not evidence-based. So make sure that as you're doing your research, you are researching based off of evidence. And I want to encourage you today to get vaccinated if you have not done so already, and encourage your peers, encourage your family to get vaccinated as well. So I listed a couple sites here that are available for vaccinations. North Carolina A&T, of course, on Tuesdays is open to the public. There is the link if you would like to sign up. We've partnered with Cone Health, so you could also go to the Cone Health website and register to get vaccinated. And of course, there are some other links there, Guilford County Health Department, Zion Baptist. It really doesn't matter where you go, as long as you go get vaccinated. So if you're someone who's straddling the fence, then please let me encourage you to take that step. So I know this presentation was pretty short, and I wanted to make sure that I keep everybody's attention. If you have any additional questions, feel free to drop them in the chat box, and I am here to answer any of those questions.
Thank you, Dr. Webb. While we're waiting for some of the questions to be posted in the chat, one question I do want to pose to you: what is some information or advice that you can give to parents as their children are returning to school and returning to college?
I absolutely would not send my my child off to college without a vaccine. And that, again, it's certainly a personal decision, but we know that a college campus, everyone is in close proximity of one another. And even though we try to remain responsible for our own actions, if you have a roommate, you have to be responsible for that person's actions too. And some of those things you just can't control. But you can control vaccinating yourself so that if your roommate becomes positive for COVID-19, then you have a level of protection there. As children are entering school, if you have a child that's 12 and above, I highly encourage you to get them protection, to get them vaccinated. There's not much social distancing in the classrooms. And again, they go to lunch, they take their mask off, even though brief, they still take their mask off. So I want to make sure that everyone is encouraged to just vaccinate your kids, give them the best protection that you possibly can.
On the college campus, what is, I guess, the protocol? What would that be if a student happens to become infected with the virus? What is the protocol in reference to that and quarantining them from the roommates and the rest of the students on campus?
Mm-hmm. So at A&T, and this is a lot of UNC systems are following this same protocol. We do 2 tests. One is a rapid antigen test. So it gives us results in 15 minutes. It allows us to detect the virus quickly and isolate quickly. But we follow it up with a PCR, which is the gold standard, the test we really should be using to isolate the virus. But that test can take about a day to come back. So guess what? In that day, that person could have infected 3, 4, 5 more people without the rapid antigen test. So our standard practice is rapid antigen test paired with a PCR so that we can isolate those people that are going to be positive on the rapid antigen test. We have an isolation and quarantine space. So isolation is for positive cases. The quarantines are those people that have come in contact with the person that was positive, who could potentially become positive over the next few days. They may have a negative test today, but what we know is that it can take the virus 3 to 5 days to show up positive on a test. So we quickly isolate and quarantine students, faculty and staff even, but we do have an isolation space on campus.
Awesome. Now, what can a student do if say for instance, their family got them vaccinated prior to them coming, but once they get there, they realize their roommate has not been vaccinated, and they feel as though that might be a problem for them because they don't know, what the roommate may be doing outside of the dorm and things of that nature. What can a student do if something like that happens?
So I would encourage them to have a conversation with their roommate. We have vaccines available on campus every single day, and most college campuses do that same thing. So I would encourage them to encourage their roommate to be vaccinated as well, so that they have the best level of protection. I don't think that it's realistic to say that I'm going to mask around my roommate, but you can certainly try to encourage that person. And you protecting yourself once again by being vaccinated, you are the person that you can control. You can't really control the behavior of other people, but you can try to minimize your risk of becoming infected with COVID.
Okay, very good. Okay, let me see if we have any questions. Any other questions from anyone that's on the Zoom call? Okay, I have one here. Has the school decided to make the student get the vaccine before returning to school? If they do not, will they have to withdraw?
So no, there was a lot of discussion about whether or not to mandate the vaccine. The Pfizer vaccine does have FDA approval, and I really feel like there's going to be a lot of momentum with mandates now that it has been FDA approved, and it's not under the emergency authorization use. Schools are not mandating the vaccine. They are certainly strongly encouraging, and a lot of schools are testing weekly if you're not vaccinated. So if you're not vaccinated, you're either testing weekly or you're vaccinated. So you can kind of make a decision there for those who maybe just really, feeling pretty firm about their decision on not being vaccinated. You still have an option. And no, you do not have to withdraw. That is the option that you have.
Okay, are there any more questions from anyone that's on the Zoom or in our Facebook chat? Are there any questions from our Facebook chat?
I don't see any questions from my Facebook chat, but I will say if I was a parent, how would I know that precautions are being done to make sure when my child goes to school that they will be protected or protected?
So I would say if you have any questions about it, contact the Student Health Center at that particular college. All universities are required to have what we call an Aggies Care website that basically outlines the protocols and procedures. And most schools have that. So I would encourage you to go to their website and see what their protocols are with regards to isolation and quarantine for faculty and staff, as well as for students, so that you will stay in the loop on how those situations are handled. They don't really, it's pretty consistent across the board on how people handle isolation and quarantines. And there's also dashboard updates. If you go to the school's dashboard, it'll tell you how many positive cases there are on the campus, and if they're in faculty and staff, or if they're in students. And so that information is very, very helpful. You'll be able to see where clusters may be identified, where there's a group of people in a particular area that may be positive. And so you can make some smart decisions by, viewing that website. If you know that there is known COVID in a particular area, if there's a cluster there, then you know not to go into that area unless you absolutely have to.
And at what point, I'm also an educator, at what point will we know if they will close schools like they did last year? Is there a percentage of schools that have to be, the students have to be quarantined or affected? What would be the percentage for that before they decide?
So there are a lot of factors that go into it. It's no one single factor that goes into the decision making when it comes to deciding to close or not close the school. But I'll tell you, for us, it's based off of our positivity ratings. How many people are actually testing positive? Do we have enough space? Can we care for these people safely? Are we appearing to be a vector inside of our own community? So is the positivity rating on campus exceeding that of the state and the local level significantly? If it is, then that lets us know that we've got to do something different, like we are an infectious source. So there are a number of factors that go into that decision making, and it is driven by positivity ratings, the amount of people you have positive on campus, by many factors.
Okay, we have a question from our chat. If a student has to quarantine, will they be able to still attend classes remotely?
They will. If they decide to quarantine on campus, they will be provided a laptop if they don't have a laptop. And of course, will still have access to Wi-Fi, and they can, log into their classes that way. So there is a virtual option for faculty and staff to be able to stream their courses that way. So yes, you will still be able to attend classes. You won't miss anything there.
So what is it that we can do not only as a group, but as a community to encourage students to get vaccinated, or if they choose not to be safer? Because, you know, a lot of times, you know, students like to congregate together, like you said, you know, in clusters and whatnot. So what can we do as a community to encourage them to not only be safe, but to, you know, just, I guess, seek out more information and resources about getting the vaccinations?
So I would say first and foremost, wear your mask. Whether you are vaccinated or unvaccinated, that is your first line of defense. If you're straddling the fence about whether or not to get the vaccine, I encourage you to email me, and I'll drop my email address in the chat box just so we can kind of talk through why it is you feel the way that you feel about getting vaccinated or not. So please reach out to me. It was one other thing I was going to say, and I apologize. I'm sure it'll come back to me, so I apologize for that. Sporting events. If you are attending, and so there's a question about what is your feeling about sporting events, sports events, and masking? I would certainly, especially with the Delta variant being as prevalent as it is right now, I would certainly put a mask on at any event that's crowded, whether it's a sporting event or concert, even if it's the movie theater, and they're not social distancing. I would encourage you to put a mask on indoors or outdoors at this point. Well, I will be here. If you have any questions or concerns about anything, I'll turn this back over to Jovan for her to facilitate the rest of the program. But feel free to email me if you have any questions. And I am dropping my email in the chat box. Thanks for taking time today to listen.
Thank you, Dr. Webb, for that awesome presentation. And as she stated, if you have any other questions, you know, that you think about after this Zoom call is over, please feel free to email her or email some of us, and we can get the questions and whatnot to her so that she can answer them for you. Next, what we're going to do, before we bring on our next presenter, we're going to show a brief video clip about National Council of Negro Women. But before we do that, I would like for everybody to go to the Facebook page and just share on your Facebook this presentation so that others may see this wealth of information that is being presented.
Mine, I'm gonna let it shine.
From the cotton fields of South Carolina to the halls of power in Washington, D.C., one woman with a vision overcame great odds and obstacles to fight for justice and equality for all.
She was far beyond where some of us are right now. When she talked about this Black country woman had the audacity to start a school that now is a huge university. That this country Black woman have the audacity to meet with presidents and become their liaison between them and the African American community. Just imagine if she was here, where we would be today.
Recognizing the need for unity and action, Dr. Mary McLeod Bethune's imagination led her to create the National Council of Negro Women, an unprecedented organization that at its inception provided a platform for Black women to pursue equality, education, and political power. Dr. Dorothy Height built upon this vision and imagined an organization that not only continued to empower African American women and youth, but embraced the entire family. She imagined that NCNW was more than just an organization. It was a movement, a force for change in America and abroad. These prolific women imagined the possibilities, saw the potential, and implemented a plan to draw on the collective power of Black women to address critical issues: health, economic empowerment, education, public policy that affect the quality of life for African American women, their families, and their communities. They imagine. Today, the mission remains the same: to lead, develop, and advocate for women of African descent as they support their families and communities.
Our history is so rich. The National Council of Negro Women is such a rich organization in terms of what we have within our group. And we bring all these people together: community, colleges, churches, fraternal organizations, political, civic groups. Just imagine what we could do. We could change this country.
NCNW programs and services touch the lives of women from all walks of life. One of the largest and longest running programs, the Bethune Recognition Program, was founded in 1974 by women leaders from New York, New Jersey, and Connecticut, who imagined the impact that an annual fundraising event could have on the sustainability of the organization nationwide. They wanted to create a platform to honor and publicly thank individuals and affiliates that gave or raised funds during the year to provide annual financial support for the work of the national organization. In turn, they would be designated as Bethune Achievers. Now known as the Bethune Height Recognition Program, it is one of the primary driving forces that supports the existence and growth of the Council. Monies raised through the program help offset operational costs, expand organizational capacity and resources, and support the Council's national and international influence and reach.
I'd like to believe that my involvement in the Bethune Height Recognition Program is making a difference. I believe that every one of us that participates and raises $300 and strives in our fundraising efforts are having a tremendous impact on not only the sustainability of the organization itself, but we really are contributing to the overall transformation of lives, of families, of children. And to me, that's what's most important. Just imagine if we all, every single member, were a part of this recognition program, the difference that we could make. Just imagine the lives that could be changed. Just imagine the empowerment, not only of women, but again, looking at our youth. We're at a critical time in our history as African Americans, and the impact that we all can have in being a part of this program does make a difference.
The Achievers have reached record numbers. This dedicated and expanding intergenerational core of women and men are making an impact, helping the organization thrive, and are making a difference. However, there's still work to be done.
We're looking for young ladies so that they can imagine the impact that they would have, not just on the girls and the women and their families in the United States, but in Africa, all over the world. We need the young women to come in and just go right off of us, roll right off, take it right from us, and keep this organization going.
Anyone can become an achiever. By raising $300, you give new life to a dream. Give life to our communities. Give a new generation the light of imagination, or the ability to imagine. We should all be achievers. Our participation in this program is critical to the organization's continued success and growth.
If nothing else is remembered about the program, by participating, being an achiever, being a legacy, or being a life member, you not only support the National Council of Negro Women, but you support and honor each other.
Just imagine if every single member across the country became an achiever.
Just imagine what the program would mean and what people could do if they would only, get started and implement it. You could reach so many other people, young people, and that's where it would make such a difference on the organization. If every area would just say, well, we are going to do the Bethune-Height Recognition Program and involve them and let them know that whatever they do is needed and appreciated and presented so that others will catch on, and it would mean so much to the basic operation of the organization.
Just imagine the empowerment we can have as women if we combined our resources, gifts, and talents, and our financial assets together to fight poverty, famine, and strife in our community here and abroad. Just imagine if we all participated in the Bethune-Height Recognition Program. We will continue to fuel the dream of Dr. Bethune to exist in an America that afforded democracy and freedom to all and equips every young African-American boy and girl with the knowledge, tools, and resources to excel and reach their full potential. Just imagine what we can achieve.
Thank you, President Margie, for that, showing us that video. And I hope all of our guests who are not a part of the National Council of Negro Women gain an understanding of what our organization is about, and would consider possibly becoming a member and helping to support the additional causes that we will be doing in the near future. Next, we have coming up is Willetta Alford. Willetta Alford is going to, first of all, introduce herself, but she's going to talk to us a little bit about nutrition and exercise.
All right. Good evening, ladies. Thank you for having me on. I'm so happy to be here with you, learning about a lot of information and also contributing to the community and what we know to stay healthy. My name is Willetta Alford. I go by Will. I am the owner of Willpower Health and Fitness in Trifecta Fitness Studio, and I am a personal trainer and nutrition coach. So thank you for having me, and I'm truly honored to be here and share this information with you. So first of all, we want to talk about overall health. So we know that usually as women, we're ripping and running and we're taking care of everyone, and usually we're the last person on the list that gets taken care of. But we want to make sure that we are definitely taking care of ourselves so that we will be able to make sure that we are able to do those things. And the first part of that is our health and fitness. So going to nutrition, I'm going to give you 5 quick tips to help you on your nutrition journey. And these are like easy tips that anyone can implement. Okay. So a lot of times when people come to me and they want to know more about nutrition, they kind of want to jump out there. Okay. But what I want you to remember is those small little changes that you can make along the way that are sustainable for you are going to make the biggest impact. Okay, so one of the first things that I want you to think about is just simply increasing your water. Hydrate. So we know that we need 8 glasses of water, 64 ounces a day at the minimum. And then if you want to go on and take that a step further, you really need half of your body weight in ounces. So if you are a person, let's say you weigh 180 pounds, then you want to make sure that you're getting in 90 ounces of water. Okay, so real simple tip, just drink more water. All right, that's going to help with inflammation. It's going to help us hydrate, cleanse our bodies, detox, and then it's just going to give us overall health of our bones and lubrication in all of those things. So great health benefits with just increasing your water. Another mistake that many of us make is eliminating food groups. I know a lot of us have heard about doing no carb or lower carbs, and it is important to lower your carbs, but you still want to make sure that you have the ample amount of carbs that you need for your body. Everything does not work for everyone, so we want to make sure that you are catering to your needs and your goals. So what I mean by not eliminating food groups, in each of your meals, you want to make sure that you make your meals count. And making your meals count means that you want to have a protein, a fat, and a carb in each meal. Now, there are a lot of resources online where you can go and you can put in your measurements and your age and your weight, and they will shoot you out what we call your macros. So your macronutrients, your proteins, your fats, and your carbs in your daily amount that you need in order to maintain. You can also put in your amount that you would like if you are looking to lose or gain weight. So definitely take part in, definitely go online and Google those calculators and see what you need for your goals in your body. Okay. Simply the next tip is just to move more. Okay. And by moving more, I don't mean that you have to go to the gym and do an hour or an hour and a half workout. I just mean you need to make sure that you are pushing your body beyond its limits. That can mean that you're outside working out in your garden, you're cleaning around the house, you're taking a walk in the neighborhood, you're deciding to take the stairs instead of the elevator. So those little quick tips just to push your body to move a little more. If you know that you're not a person that is into working out as much, if you have a Fitbit, you can increase your steps. So maybe instead of doing 5,000 steps a day, you can move up to 7,000 steps a day. And even if you don't have a Fitbit or Apple Watch, you can kind of calculate how much you're moving a day. So just take those steps to move more. We need 150 minutes of exercise a week. So that kind of cuts down into 30 minutes for 5 days a week, or you can do 3 days a week and kind of play with those minutes to adjust to your schedule and your needs. Now, I know you hear me saying your needs and your goals, okay? So another tip that I want you to remember, this is your body. You can't compare it to anyone else's. You can't, get a microwave diet and overnight success. You need to make sure that you are thinking about yourself, your health, your goals, okay? Yourself, your health, your goals, ladies. Okay, so the other tip that I want to encourage you to do, if you're not familiar with how to do any of these things, as far as your meal planning and your fitness or your overall health, reach out to someone that is an expert in those areas, or do your research. It's a lot of YouTube videos out there that can help you with these things. I know anytime I think about something that I want a quick answer to, I can go on YouTube and it usually pops up. So just think about those tips that I just shared with you, and your goal, yourself, your health. All right. So I think that I have a little bit of time to do a quick mini session. Is that right, Jovan?
Yes, that's correct.
All right. So all I'm going to do is run through some basic moves that you can do at home or on, at the gym on your own. And when you're doing your workouts and your exercises, one thing that I want to emphasize is making sure that you are doing the correct form. That cuts down on injury, and it also increases the intensity of the exercises. So make sure that you are concentrating on your form, and that is one of the most important things that you want to focus on. So Jovan, are we doing a sit-exercise? Are we doing like a mixture of both? Are ladies getting up and getting involved, or do you just want me to kind of run through some basic moves?
A mixture of everything.
Okay, all right. I like to hear that. All right, so we're going to get started, ladies. First thing I'm going to do is some jumping jacks. So I'm going to show you some variations of jumping jacks. I'll start standing up since I'm already up. But with your jumping jacks, you want to make sure you have your abs pulled in, you're breathing in through your mouth and out through your nose, and you're just going to bring your hands above your head and move your legs outward, okay? All right, so that's your basic jumping jack. Now for you ladies that say, okay, I'm not really there yet, I have some modifications for you. All you have to do is step out, okay? Keeping those abs tight. And we're just stepping out.
Is everyone moving?
All right, let's get to moving. I can't really tell. Some videos are off, but I'm going to trust you and trust that you're moving. Now, I may have some ladies that are sitting down. You can also do these sitting down. All you're going to do, you don't want to sit back in your chair. You want to kind of come on the edge of your chair and do that same movement, going in and out. All right, you got about 5 more seconds. In time. All right, got a few seconds to rest here. While you're resting, I'm going to do the next exercise. All right, next exercise. We're going to go into high knees, okay? So your high knees, I'll show you the standing version first, the modified version, and then I'll show you the seated version. All right? All right, let's go. So standing version. Legs are coming up. Modified version. All you're going to do is turn that into a knee tap and bring that knee up and tap. Keep those abs tight and engaged. Good job, ladies. I see you working. All right, so for the seated version, you're just going to bring those knee taps, your hands above your head and tap. Good job. Still on the edge of that chair, not leaning back. Good job, ladies. 5 more seconds.
It's a good workout on the arms too.
It definitely is. And time. All right, we have a little rest here. Everybody warmed up? I'm just going to keep moving at a march. In a few seconds, we're going to go into punches, okay? So your punches, you can do 2 things here, and I'm going to show you the first. Legs a little bit over shoulder width apart. You're going to bring those arms up, and you're just going to twist, 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 twist. As you're doing that, you're twisting your abs, okay? Slight bend in the knees. So you're getting that ab workout. Good twist, okay? Now you can advance that move by going down into a squat if you like and doing the same thing. Twisting those abs, throwing that punch. Good job, ladies. Looking good. And for my seated ladies, you're doing the same thing. Good job, ladies. 5 more seconds. You've got it. And time. Got a few seconds on the rest. We're going to go into some ab twist with a leg lift. All right, so your hands are going to come behind your head. All you're going to do there is tap over and tap over. Okay, bringing that leg up, targeting the elbow to knee. It's okay if you don't touch your elbow to your knee, but that's just what you're aiming for. Still breathing in through your nose and out through your mouth. All right, so my ladies that are sitting down, you're doing the same thing. Hands behind your head, and you're just gonna edge up on your chair. Lift those knees. Good job, ladies. 5 more seconds. And time. All right. Got a few seconds on the rest. You can free to grab some water if you need to. Got 2 more things for you. All right. So this is something that you can do as you're sitting down at work or at home. I know maybe some of us are working from home or sitting down a lot in the office. So when you're sitting down at your office, there are some things that you can still do to kind of keep yourself going. All right. So I'm going to come to the edge of my chair like so, and I'm just going to kick out. Kick out and extend that leg as far as you can. Make sure you're not leaning back into your chair. If you are not, you should feel the tension in your abs as well. If you are someone who has knee issues, instead of extending that leg out, just lift that leg up, just like this. Just like we did those high knees. Lift that leg up. You should feel a burn in your quads and in your abs. Got 10 more seconds, ladies. Good job. And time. Good work, ladies. One more move, sitting down. This one, you're actually going to lift both of your legs at the same time. I'll show you the original version and then I'll show you a modified version. You're still on the edge of your seat, holding your hands right beside, standing up straight, not leaning back in that chair. And all you're gonna do is lift and tap, lift and tap. You get a great ab and quad workout here. You'll also feel that in your lower back. So tapping both at the same time. Modified version, you're just gonna tap one at a time. Keep those hands up. Good job, ladies. 10 more seconds. And time. Good job, ladies. And the last tip that I'm going to leave with you is making sure that you stretch, okay? So I don't care if you're not working out, stretching is going to be very, very valuable to your muscles and your bones, help you move a little bit better. So even if you're just sitting at home and watching TV, just take a few minutes to stretch, okay? You can do some dynamic and static stretching. You want to always make sure before you're doing any workout, you're doing stretching and motion, which is your dynamic stretching, okay? After workout, you want to do static stretching. So your static stretching would be an example of a quad stretch where you're just standing there and holding that stretch for about 20 seconds, okay? Your dynamic stretching would be before the workout where you're actually warming up, and that would be an example of like crossing your arms over, or arm circles, or hip circles to get those muscles moving and warmed up for the exercises that you're about to do. Okay, thank you ladies so much for having me. I don't know if anyone has any questions or anything. If you do, please feel free to ask.
This is Jovan. Yes, we do have some questions, and goodness, that was a workout. That was a workout. One of the questions that has been posed in the chat, out of all the exercises that you showed us how to do, how many reps should you do of each one?
Okay, so if you're a beginner starting out, you usually want to do like 6 to 8 reps, depending on what you're doing. So if it's weight training or strength training, usually about 6 to 8 reps. If it's something like I was just doing with you, like a strength / cardio or a hip move, for example, jumping jacks, you kind of need to start where your body allows you to. So anywhere, some people can start out and they do 10. It just depends on your level, and other people can start out and they can do 25. But I would suggest trying to do that first 10 and then seeing where you're at. If you need to decrease down to 5, or if you feel like, hey, I can keep going, then go on up to 15 and then just keep increasing as you go along.
Okay. Another question. Can you, a statement, can you explain the importance of working the whole body and not just parts that you think need to be worked on? Because, so often, sometimes we may say, well, I really need to work on my stomach, but everything else is fine. So we just concentrate fully on our stomach. So explain the importance of working on the whole body.
Okay, so I'm glad you said that, because I have a lot of people that come to me and say, oh, I just want to lose my stomach. I don't want to do anything else. Well, the thing with that is you can't spot train fat. So in order to get your stomach or whatever part of the body that you really want to focus on, you need to lose overall body fat percentage. And what happens is, in losing your overall body fat percentage, the mistake that a lot of people make is just doing cardio. Okay, so when you do cardio, you're going to lose weight all over. We know that. But usually you're going to also lose some of the muscle and some of the curves, as we call it, to the areas that you really want to keep or just tone up. So the key to doing that is having a mixture of exercises, like your high intensity interval training mixed with strength training and cardio. You always want to add in strength training, whether it be body weight, resistance training, or lifting weights. And that's really what's going to help you keep those curves or kind of maintain the other parts of your body that you do love and want to lose less of, because it's going to help you maintain that muscle versus just doing cardio that starts to usually feed into the muscle because people are doing too much cardio and not picking up those weights as well. Okay.
Now, on the nutrition side, how important is it to minimize your sugar intake? Because
oh my goodness.
Some say sugar can actually make you a little bit bloated or whatever the case is, but explain how that, I guess, enhance your, not only your weight loss, but your overall healthy being.
Yes, absolutely. So decreasing your sugar intake is very important because it does cause bloating. It causes inflammation. So a lot of times you'll have patients or you'll have people that come to you and they may have arthritis, or they may not even have arthritis, but they may just have some aches and pains here and there. And it's because their body is filled with so much sugar, and that inflammation is starting to feed into their joints, and it's just bad. So once you start to decrease that sugar intake, you will find that your body just moves overall better. You're not as bloated. You're not having issues with inflammations. You're not having those weird headaches throughout the day because that sugar is spiking your blood at one point and then you're kind of crashing at the end of the day. So you want to make sure that you're definitely looking at what you're doing with your sugar. And another thing is, I'll have someone says, well, I don't eat a lot of sugar. And then I look at their meal plan, it's filled with certain carbs turn into sugar. Okay. So you also want to make sure that you are looking more for your complex carbs instead of your simple carbs.
Okay. Also, can you tell us a little bit about the difference between changing your eating habits and dieting? Because, you know, a lot of people, you know, will go on the different diets, and, you know, I'm not going to name them, but explain the difference between actually changing your eating habits to help your overall healthy being versus dieting.
Okay, so personally, I hate the word diet. I feel like when people hear the word diet, they immediately feel like they're deprived of something. So I would say it's very important because when you think about diets, it's usually some fad diet. It's okay, I'm going to do low carb for a while. Okay, I'm going to do keto for a while. Oh, well, I'm doing this, or, you know, I'm just doing different types of fad diets. And it's something that you are not going to sustain long term. So you really want to change your thinking to, okay, let me do a lifestyle change. Just start with little small things that I know that I can actually keep up and practice, and they can become a habit. So always think to make those small changes instead of thinking, oh, well, I'm going on this diet.
What are this is a question in the chat. What are the best sugar substitutes?
Okay, so when it comes to sugar substitutes, it really depends on what you're trying to substitute it for, but you do want to stay away from the little yellow, blue, and pink packets, as I call them. So your equals, your sweet and lows, and your Splendas. Now, Splenda, definitely in moderation, it's probably one of the better sugar substitutes in the packets. When we're talking about more natural sugars, definitely honey is a good one. Mm-hmm. You can use agave, you can use stevia. Stevia and honey to me are going to be some of your better substitutes.
Okay.
And monk fruit too, monk fruit.
Okay. Are there any more questions?
I saw somebody say all.
Yeah.
Now, I'm the type of person, I will tell you this about your little blue, pink, and yellow packets. Moderation is key to everything. I have to get on my grandmother about this all the time because she loves her Splenda. And then she'll say, well, I don't really eat that much of it. I'm like, Grandma, yes, you are. We just bought you a whole case of it. It's gone. So yeah, you're eating a lot of it. But in moderation, just, you know, start cutting back little by little. I'm not the type that'll say, oh, just go cold turkey and I'm taking it away from you. In moderation, everything in moderation.
Okay.
So and the flavor powder that you put in the water, are those good?
I'm sorry, what was that question?
The flavor powder that you put in your water for your bottled drinks.
Okay, so like the 0 calorie flavored. Yes. Okay, the thing with those, you want to watch the aspartame. So if it has aspartame in it, you do not want to use those. But the ones that do not have aspartame in them, they're pretty good. Okay. Definitely look out for the aspartame because that can cause migraines and a whole lot of other issues.
Mm.
Okay. I know for myself, I stopped eating sugar because I had surgery, weight loss surgery actually. So cut out. I started popping grapes like they was pills. And eventually, you know, when I read up on it, I saw that grapes had a lot of sugar as well as pineapples, which I love. So I stopped eating those and started eating more of my berries, strawberries, things like that. What other fruits are high in sugar?
So your berries are going to be the least amount of sugar. Anything like your grapes, bananas, I had a brain fog. Grapes, bananas, kiwi, pineapple, pretty much the ones that you gravitate to. Those are ones that have a lot of sugar in the peaches. But now think about this, they have natural sugars. Okay. So if you're eating those things, of course, like I said, everything in moderation, but eating a few grapes, you want to make sure that you're following the serving size. So if you're following the serving size, then you should be in the clear zone. So that's what you want to make sure you're paying attention to. Always follow the serving size. For fruit, that's usually a cup. Okay. So if you're not going over that, you're not tapping into those dangerous zones of eating all that sugar. So fruit, that's natural sugar. It's really the added sugars that you want to pay most attention to. So if you have that covered on that side, then eating your fruits is not going to be so much of a big deal when it comes to grabbing healthier options.
Well, yeah, I messed that up. Definitely what you said. I don't even think I was counting servings. So that was my snack at night. Okay.
Yeah, do the serving size and you should be fine. I mean, you don't want to, start having several cups a day.
Okay.
That's the thing. So, if you're having a cup, that's fine. But like I said, everything in moderation.
Right.
Okay, well, so let's just say someone is trying to get started on this healthy eating, nutrition, and exercise plan. How would you tell them to start the nutrition part? In other words, let's just say in the mornings, they're used to having this humongous breakfast with the bacon and the eggs and the pancakes and coffee and a big glass of orange juice. For lunch, they're going to one of their favorite restaurants and having all the pastas and whatnot. And then for dinner, there's like, well, let me just do all this all over again and having a big dinner. How would you tell them to start cutting back, not depriving themselves as you just stated, but how would you tell them to start off cutting some of those things back?
Okay, so the first thing that I would tell them to do is to make a plan. Okay, and if you're not sure what that plan is, then you need to seek a professional. So the second thing I would tell them to do is figure out what their why is and their goal. Because if you don't have a why and a goal, then you're just going to be out here rogue and you don't have any, you don't have anything holding you accountable. Okay, so make those goals and hold yourself accountable, and then start making small little changes. So if you're having bacon and egg and big cups of orange juice and pancakes for breakfast, start by eliminating one thing. Let's start by eliminating maybe the pancakes and going with just the bacon and the egg, and stay within your serving size. Instead of drinking that orange juice, grab some water. Or if you say, okay, well, I have to have my pancakes. All right, have your pancakes and then maybe cut down to your egg and your pancake. Okay, so you just have to create those little small changes that you can work within until you get to where you're going. But the number one thing is to make a plan.
Can you explain how red meat plays a part in nutrition, either negatively or on a positive effect?
Well, so as for me in my house, I still eat red meat. I just eat it in moderation. You're going to hear me say moderation. So the thing with red meat, if you're a person that you don't have health concerns, okay, so now if you're a person you have health concerns, you have to go with this a little bit differently. But red meat is just like anything else. You have to do it in moderation. Now, if you're having steak every night for dinner, or you're having a hamburger every night for dinner, that's not going to play good on your body overall, because red meat takes a while to digest. Okay, so we have to remember that when we're talking about taking care of our whole body. You have to look at how your body digests things and breaks down food. But if you're, want to have a burger, on the weekend or something, that is not going to hurt you if you're doing the things that you are supposed to be doing throughout the week. So again, everything in moderation. And then also the preparation of how you're doing your red meat. Okay, so you want to make, we know we want our food to be flavorful, but in order for us to have some flavor in our food, sometimes we get hooked onto what we're used to. And it's okay to think outside the box, get creative and use different things. You know, I like my food seasoned up well, but I found like different alternatives to seasoning my food. Okay, so just think about those small changes with that. And again, everything in moderation.
Everything in moderation.
Okay.
Everything in moderation. Okay. Are there any more questions? Does anybody have any more questions for Will in reference to nutrition or exercising? Are there any questions in our Facebook chat? Any questions?
No, there's no question.
Okay. Well, Will, thank you so much for this valuable information that you have given us. We greatly appreciate it. And if anyone has any questions for Will, you know, after this live is over, you can just contact a member of the team and we can get the questions to her. And that way she can contact you directly. At this time, our president, Margie McLean, is going to give us further announcements about tomorrow night, and also other events that we have coming up. And she's also going to introduce some members from other sections that are also on our Zoom Live. And Margie, I'll let you introduce our state president as well.
All right, thank you so much again. We'd like to also thank Dr. Webb, who came on and talked to us about, again, for those who missed it, thank her for coming out and talk to us about the facts and myths of COVID. We would like to thank Ms. Alford for coming through, and Ms. Will for coming in and talk to us about nutrition and ways that we can exercise either standing or sitting. And we saw a lot of great feedback in the chat about this is very helpful. These are things that they can do at work. And that's what we need to show, that you don't have to do anything strenuous. You could just be sitting, lifting your legs, that's still working out and working your body. Thank you so much for coming and giving us some tips on nutrition. Before I make announcements, I would like to introduce our state president. And after we introduce our state president and allow her to say a few words, then I would like also for any members of NCNW to come on and introduce themselves and what section they are representing. Turn this over to our state president, Ms. Queen DeGraffrey.
Good evening. Another powerful, empowered night of knowledge and education and training and all the things that I need to be doing. So can you all hear me?
Yes, ma'am.
Okay. I'm not sure. Can you hear me now? I'm on my phone and it keeps going out.
We can hear
you. Okay. Well, the picture kept going out, so I didn't know whether I was on or not. Okay. Again, want to thank President McLean for this innovative idea. She had the idea already of a statewide health career fair. And at the same time, we were moving toward our national initiative, Good Health Wins. So we combined them. And with this being National Immunization Week, a month, we combined the two. It works right out in that we are addressing the needs that National Council of Negro Women have asked us to address, as well as meeting the needs that we here in North Carolina and probably all over the country need to be taking a look at, and that's being proactive about our health. Just a quick announcement. We have to double duty sometimes, just like we are combining this effort. Good Health Wins is having an initiative, an opening initiative tonight on the West Coast. And It's called Baby Talk. It comes under one of our programs. We're trying to get all of our states to take an initiative and do a good job at it. And then we share around the country. And that's part of the mission of empowerment in our mission statement. So at 8:30 our time, which is 5:30 California time, that program will be on. President McLean has put up the flyer, and we're asking those who can, even if you can't stay on the, I think it's an 1.5 hour program. You've already been on 1 hour and a half. Just go on for a little while to help get the counts up and show that North Carolina cares and North Carolina is supporting. I would appreciate that. That's part of my role, is to help connect folk and connect resources. So I would appreciate that very much. And the flyer with the links is there for your information. Again, thank all the other sections who have participated this week. And I hope you continue tomorrow night. I don't think I'll be able to come tomorrow night, but this is what we're about. This is what we're about, and I appreciate it so much. And thanks again, Margie, and to your committee for all the work that you have done in orchestrating this great week of activities. And I see all of our activities and programs there with Good Health Wins. So thanks so very much. And good night, everyone.
Good night. Good night. Thank you, President Queen.
Sure.
Hi, Margie.
How you doing?
Did you want us to introduce ourselves now or later?
In a few minutes. I'm getting ready to in a few minutes.
Okay, all right.
So before we announce, I wanted to also announce that NCNW has partnered with Uber for 4 free rides up to $25 each per person to and from a vaccine appointment. This will end September 30th. The promo code is NCNW, and you see the states that this promotion is happening in. You also will see the steps on your right-hand side of how to order your Uber ride for this time frame. So again, please take advantage. If you don't have a ride, you now have a ride with Uber. So we're gonna go ahead and have our different members from different sections to introduce themselves. And since Deborah is so home, I'm gonna start with her. Go ahead, Deborah.
Thank you, everyone. Good evening, everyone. My name is Deborah Holmes, and I'm the past president of the Metropolitan Greensboro Area Section. And Margie, I have truly enjoyed this webinar and the speakers. I really learned a lot this evening. Please continue on with the good work that you are doing and will continue to do, I'm sure, because that's the type of personality and person you are. So I just wanted you to know that I really enjoyed everything that I learned this afternoon or this evening, and I will definitely take it to heart. Thank you.
Thank you so much. I appreciate you joining us. Next, do we have Miss Crops on? Is she on?
Yes, thank you very much. I appreciate what the previous person just said. Everything is applicable to me. I really enjoyed myself. I was able to put in some seated steps and just keep on doing what you're doing. It's wonderful.
Thank you.
And I'm Sandra Cross from the Durham section, president of the Durham section.
Thank you so much. I think we also have Miss Mary Highsmith. Is she on? Miss Mary Highsmith?
I saw her name.
She's on mute. She's on mute.
Okay. All right. I believe Miss Mary Highsmith is a member of the Fayetteville area section, and our state president is also the president of the Fayetteville area section as well. We also have Miss Georgia Shepherd and our historian Christina Austin, who is also an organizer of this wonderful week. Would Miss Shepherd have anything she would like to say? Everybody shy today. Okay. Okay.
Hi, Mary Highsmith. Sorry, I got in late. I enjoyed the exercise. This is wonderful, Sister Margie.
Thank you so much.
And President Queen. Thank you guys for doing this. I enjoyed it.
Yes, yes, and President Queen.
Sure, thank you. I'll ride off of Marge's hard work.
So I would like to thank again Ms. Jovan Turner for hosting tonight, and also Christina Austin. These two are the ones who actually put this week together and put together our speaker series. So I really would love to thank them for doing that. I'm trying to bring people out of their shells, and they've done a wonderful job. Tomorrow we will have Dr. Harvey Chip Rice. He's the host of WNAA 90.1, The First Light. He will actually come and give a motivational speaker presentation about what kind of life is this, pretty much living with COVID and the whole situation that we're dealing with now. He's going to come and end us off with a motivational speak. So we hope you can make it tomorrow, same time, same link. Please invite other people. If you see this on Facebook, please share. It will be on our Alamance-Guilford section page. We also post it on our North Carolina State Facebook page, and it will be on my page, Margie McLean. If you are one of my friends, you can share this as well. Please, please come in and let's end this off with a great number of people on the call. And also, I also want to end with the fact that we also, Alamance-Guilford section is also going to be offering a vaccination clinic as well. That would be in October. More information will come. We have partnered with the Guilford County Health Department. They will be coming in and at the Charlotte Hawkins Brown Center, and we'll be hosting an area for people to come and get their vaccines. If it's your first, second time, or the booster, you can come. We also will be giving free items away, snacks and things like that. And you will get a chance to get information about NCNW and the Charlotte Hawkins Center. So please look forward to that information coming out. Also, I would like to end with the announcement that I'll be hosting a domestic violence awareness webinar October 24th at 4 p.m. Is part 2 of When Love Hits Home, Chronicles of Domestic Abuse. This time we'll be talking about domestic violence in the church or in other religious arenas. So please come and join us as we talk about the red flags. We have Lady Maxine Lewis, who was is a domestic violence survivor. We also have other domestic violence survivors here, as well as our motivational speaker, Reverend George Coates. So if you have an opportunity, please register for this event. We hope that you will see it. The last one was really powerful. And you also can find it on YouTube of the Margie McLean Foundation. So please join us on that Sunday. Again, I would like to thank our speakers and thank our visitors for joining us, and we shall see you tomorrow. Thank you again to our host, Ms. Jovan Turner. Appreciate. Thank you. She's one of our newer members, and she came in smoking, ready to work, and I love that.
Okay.
So if you are
remind people to join the baby talk for a little while, even if they can't stay.
And also join the baby.